Notice, the people appearing in the video are for illustrative purposes only. They may not be real doctors or patients. Thank you. Hello and welcome back to our channel. In today's digital age, the internet is woven into almost every aspect of our lives. There's a hidden challenge that many of us might be facing without even realizing it: internet addiction disorder. Internet addiction disorder, or IAD, is a condition that's gaining attention worldwide. It's not just about spending a little too much time online. It's when the digital world starts to significantly impact our daily life, mental health, and overall well-being. Are you finding it hard to log off? Does your screen time leave you feeling drained rather than refreshed? You're not alone. Today, we're diving deep into the world of internet addiction disorder. We'll explore what it is, how to recognize it, and what we can do about it. Definition and scope. Internet addiction disorder, sometimes referred to as problematic internet use, PIU, or compulsive internet use, CIU, is not officially recognized as a distinct disorder in the DSM-5. However, it is increasingly acknowledged as a significant behavioral addiction, sharing similarities with recognized addictions such as gambling disorder. Symptoms and diagnostic criteria. The symptoms of internet addiction disorder include excessive use, an overwhelming preoccupation with the internet, often manifested in prolonged usage. Withdrawal, emotional and physical symptoms like moodiness, anxiety, or irritability when unable to access the internet. Tolerance, the need to spend increasing amounts of time online to achieve the same level of satisfaction. Failed attempts to control, persistent desire and unsuccessful efforts to cut down or control internet use. Loss of interest, neglect of hobbies and activities in favor of internet use. Continued excessive use, despite understanding the negative consequences, such as impacting relationships or job performance. Deception, lying to family members, therapists, or others about the extent of internet use. Diagnosis typically involves an assessment by a mental health professional, who considers these symptoms in the context of the individual's life, ruling out other mental health disorders. Causes and risk factors. The causes of internet addiction disorder are multifaceted, involving a combination of psychological, social, and biological factors. Psychological factors. Conditions such as depression, anxiety, or other mental health disorders can contribute to IAD. Social factors. Loneliness, lack of social support, or difficult life transitions can increase dependence on online interactions. Biological factors. Genetic predisposition and neurological factors may play a role in susceptibility to addictive behaviors. Youth and vulnerability to internet addiction. Adolescents and young adults are particularly susceptible to internet addiction disorder. This vulnerability is due in part to their developmental stage, characterized by heightened sensitivity to reward and peer influence, combined with still maturing self-regulation skills. The immersive and interactive nature of digital media, from social networks to online gaming, particularly appeals to this demographic, increasing the risk of addiction. Societal and cultural influences. Cultural and societal norms significantly influence the prevalence and perception of IAD. In some cultures, heavy internet use is normalized, while in others, it's more stigmatized. Societal shifts, such as the growing reliance on technology for work and education, also play a role in the development and recognition of IAD. The role of technology in IAD. The design and functionality of digital platforms often contribute to addictive patterns. Features like notifications, infinite scrolling, and social media algorithms are designed to maximize user engagement, often at the expense of users' well-being. The impact of COVID-19 on internet use. The COVID-19 pandemic has brought unprecedented attention to internet use and potential addiction. Lockdowns and social distancing measures led to an increased reliance on digital platforms for work, education, and social interaction. This shift has sparked new discussions on the boundaries of normal versus problematic internet use and highlighted the need for better management strategies in a digitally dependent world. The impact on health and lifestyle. IAD can have profound effects on physical and mental health. Physical health. Neglect of physical activity and poor ergonomic practices can lead to issues like obesity, carpal tunnel syndrome, and vision problems. Mental health. IED can exacerbate or lead to conditions such as depression, anxiety, and social isolation. Social and occupational impact. Strained relationships, social withdrawal, and impaired job performance are common consequences. Treatment and management strategies. Treatment for IAD typically involves a multi-pronged approach. Acknowledging the issue. The first step in addressing internet addiction is acknowledging its presence. Recognizing that your internet usage is beyond normal limits and is causing negative impacts is crucial. This recognition is often the most challenging step, as internet usage is deeply integrated into daily life. Understanding underlying causes. Internet addiction often stems from underlying emotional or psychological issues. It could be a coping mechanism for stress, anxiety, depression, or social isolation. Identifying these root causes is essential as it allows for a more targeted approach to treatment. Setting realistic goals. Define what a balanced internet use looks like for you. This involves setting clear, attainable goals. For example, you might aim to reduce your online time by a certain percentage or limit social media use to specific times of the day. The key is to set goals that are challenging yet achievable. Developing a structured schedule. Creating a daily routine that limits time spent online can be effective. Allocate specific times for internet use, and ensure to include other activities that you enjoy and find fulfilling. This structure helps in gradually reducing the dependency on the internet for entertainment or emotional relief. Engaging in physical activity and new hobbies. Physical exercise and new hobbies can significantly reduce the urge to spend excessive time online. They not only occupy your time but also improve mental health, reducing the need to escape into the digital world. Implementing mindfulness practices. Techniques such as meditation, yoga, and mindfulness can be beneficial. These practices help in managing impulses and increasing self-awareness, making it easier to resist the urge to excessively use the internet. Utilizing technology to limit use. Ironically, technology can also aid in combating internet addiction. There are numerous apps and software that track and limit internet usage. Features like website blockers or time limit notifications can help in maintaining control over your online habits. Seeking social support. Sharing your goals and struggles with friends and family can provide you with a support network. This social backing is vital in times when you might struggle to stick to your goals. Additionally, consider joining support groups or online forums where people share similar experiences. Professional help. In cases where self-help strategies are not enough, professional help should be considered. Therapists, particularly those specialized in addictive behaviors, can provide guidance, support, and therapy, such as cognitive behavioral therapy, CBT, which has been effective in treating various forms of addiction. Education and awareness. Educating oneself about the negative impacts of excessive internet use can serve as a motivation to change. Understanding how it affects mental health, sleep patterns, and personal relationships can reinforce the desire to reduce usage. Environmental adjustments. Making physical changes in your environment can also help. For example, keeping devices out of the bedroom can reduce the temptation to use the internet late at night. Replacement activities. Identify activities that are fulfilling and can serve as alternatives to internet use. Engaging in these activities can provide the satisfaction and emotional connection that one might seek online. Conclusion. Internet addiction disorder is a complex and multifaceted issue that reflects the challenges of living in an increasingly digital world. Addressing it requires a comprehensive approach that includes education, awareness, psychological support, and societal changes. As technology continues to evolve, so too must our understanding and strategies for managing its impact on our lives. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up and share it with your friends. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.